Let's see. There we are. I think we are all here. Thank you so much for joining me today as we talk about digital literacy as it pertains to cancer care. I'm sure, in recent years, you guys seen this massive transformation in the workforce, in academia, and more so in healthcare as we move from traditional medicine into more of a digitized space. So conversations like this are more than necessary. And as Jody shared with us, knowing the audience and knowing the people in which we hope to serve with these resources is the key, is the foundation to developing and mobilizing methods that work. So I want to start off, I want this to be like really super informal, super personal. If you want to cry or, shout, I'm with you on all of that. So please feel more than comfortable. But I do want us to really acknowledge just socially everything that's been going on in our respective demographics around institutional and systematic oppression, because the things that have been going on socially have exacerbated these disparities we're seeing in healthcare overall, cancer disparities, and then that overlaps with our topic today of digital literacy in this space. So we've seen that as of recent, as the pandemic laid siege on the entire world, we've seen that these disparities in cancer have been exacerbated since the onset of the pandemic and continue as we look to digitize methods of care and of peer support. So I want to really open the floor because I know we're kind of on a time crunch and I want to be sure we all have time to share. I want to open the floor kind of starting with some of your experiences, not only in your cancer journey or the work you may do in the area, but also your experiences navigating this digital space in the wake of the pandemic as it pertains to your healthcare. So as for me, it's certainly been a challenge. It's been a complete difference, even though I have a background in informatics, data science, and working digitally and with computers often. When it comes to healthcare, I feel like all of my knowledge and expertise go out of the window. It's something different about that connection when you come into the reality of your health and then your training as a professional. A lot of times we seek to get that information from our healthcare providers and our support groups, and we rely on that. But as that goes from the more traditional interpersonal space into digital space, how do we access that same information and get that same connection through a computer screen or over the phone or via an app? So I would like to hear from you all about some of the challenges you've had or have witnessed or have heard about. If you're not currently going through a journey, what are some of the challenges you've seen in the wake of the pandemic as it pertains to the digitized health space? So anyone can open up and we'll start from there.
I can go first. Hi, I'm KK McCaslin. I'm the Director of Programs and Community Initiatives here at the Livestrong Foundation. And pandemic aside, I think an ongoing issue in the healthcare space is health literacy. A lot of the things that we write and use to communicate with patients and survivors is at a very high reading level. And the information becomes less and less accessible the deeper you get into the conversation. And I think once you add the digital component, as you were saying, things get even more lost in translation. And something that I've noticed from the Livestrong perspective is we are very committed to person-centered care. And I think it becomes more and more difficult to personalize care to the survivor's needs when you add these additional layers of access issues, understanding issues, and comprehension issues.
Absolutely. You brought up a very amazing point with the health literacy already being a major disparity in many communities. Even I have some friends, with full PhDs and get a diagnosis, and they're like, I have no idea what they're talking about. Or they'll give me a call like, do you know what this means? And the question I like to pose to people is, what prevents us from asking those questions? I think culturally there's an assumption that the doctor is the authority figure, what they say goes, and when it comes to my health, I'm just here to listen and really not follow up and ask those clarifying questions. So how can we change that colonized mindset, or that culture of feeling, not feeling confident in asking those questions when we do have questions, feeling like it may be a stupid question, or feeling like you're taking up too much time, like you're being rushed, like there's another appointment that's more important somehow coming after yours. So I think that health literacy component is super important, because again, it's a disparity that's exacerbated when we move into the digital space, not only in specific demographic groups, but overall, in the overall community. I think as far as, digital literacy goes, only 1/3 of the American population has the vital digital skills that they need in order to function successfully in society these days, or that's the projection. So with that already being divided, and then adding that additional component of health literacy, where are we going as a nation as it pertains to healthcare, and particularly cancer care? So I think that's a really good point. The health literacy component on top of the digital literacy makes this a multifaceted problem, which will require multifaceted solutions. So thank you for sharing that. Has anyone experienced a gap when they are looking to interpret information from a healthcare provider, or even interpreting resources online around health or diagnoses?
Um, for sure, from my experience, you go and get an examination, and hey, we think there's something there. We got to do a biopsy. You go with, have the consultation, and I mean, in that interim time, I mean, one, you're still probably in some sort of not cancer diagnosis shock, but it could be cancer diagnosis shock. And I mean, I don't even want to go online to find out stuff yet, right? Because you just you don't want to like put everything in high alert and just make it even worse if it's not even what it's going to be. But then once you get to the doctor's office and it does come back positive, you're in another state of kind of shock of, especially when, in my particular instance, very active, very healthy, fit, working out like a maniac, bike riding, whatever, you name it. And it's like your spouse is sitting there and it's cancer and it's aggressive and we have to go get it right away. So, knowing what I know today, I would have probably went for a second and third opinion. Not that it was lingo that you were getting that you didn't understand, but it's just, okay, what are other options that I have out there that I should be exploring before I just tell him that go ahead and schedule my surgery, right? So, I think that's the hard part, regardless of where we're at, culturally, racially, whatever. It's, what do I ask? What are the things that I need to do to prepare myself now and going down the road, as I want to figure out what the path is I should take in this challenge I'm faced with, right? So, again, knowing what I know now, there's lots of doctors that have great bedside manner that explain things very, very well. And there's other ones that kind of minimalize things and make it very like, oh, this is no big deal. Again, I could relate to my urologist that I had at one time, who I no longer see. When post-surgery, my PSA was still, showing up. And okay, well, we need to go do radiation, and it's just no big deal, a couple shots of radiation. Well, again, you're not knowing. Oh, go visit with the radiation oncologist. Oh, you're going to be getting it every day for 6 weeks. Like, dude, that's not 2 shots. That's not a couple shots in my world. That's like a month and a half of my life. That's that we're going to like throw bad stuff at it. And so, it's just, I've been reading many various different books from folks that have been survivors and whatever. And I think probably the biggest thing that I can share, and I'm doing a much, much better job of that now, is we have to be our own best advocate. Because otherwise, like you said, he's the expert, which is how my wife took it. He's the expert. He should be helping us and guiding us in where we should be going. And, he says, oh, this is what we got to do. This is your only course of action. Well, that's not maybe your only course of action, kind of thing. So be upfront with me on that and say, hey, go get a second opinion, go here, go do this, or we have other things that we could look at. So that's probably the biggest advice that I could give anybody, whether it's digitally or however, is you have to be your own best advocate and try to educate yourself through friends, through organizations, through podcasts like yours. And again, I know it's hard for people to have access to some of those things when they don't have the technology, but I think if you reach out to other medical practices, other people in, various circles that you travel with, because pretty much any day today, you talk to someone knows someone that has been touched by cancer. And so, I think we just have to be our own best advocate, right? That good consumer
Exactly.
in the health world.
For sure. And that you had so many good points, and so many things that I feel that survivors and families of survivors can share that will benefit so many who are going through or are waiting to see if they will go through some of the challenges and things that you have gone through. And I think your insight is so important in that, even within your own community, making a list like, hey, I had these doctors that were trash and these were great, posting it in the library, sharing whatever part of your journey you're willing to share to help people along and to go across that bridge. I think that's so much of a starting point. I know that really inspired me within my community, wanting to see specific change in certain areas, injecting myself directly from my experience to even help one person was an accomplishment. That's one thing. I was in the Peace Corps for a period of time after undergrad. And that was one thing, if I can change one life, if I can educate one person, who knows how many other people they will touch. So I think what you shared is such good information about, getting second opinions and learning that there's other doctors who have other approaches and unique perspectives as it pertains to treatment and care, and how to explore and navigate that in your area. I think that you are an amazing resource for others. So I think you had so many great jewels, and I do implore you to even jot it down. Who knows, sharing that information at events like this, if I don't know where you're living, but, sharing that there may be someone close to you that's attending this event that, may be going to some of the same clinics that you've gone to that could use that information in the now, while we try to develop more scalable solutions in the future. So that's amazing. Has anyone else had similar experiences where they heard the initial diagnoses or were introduced to the idea that cancer could be the outcome, and just immediately adopted the diagnoses or treatment plan of the doctor at first go?
My grandmother, unfortunately, she passed away a few weeks ago, and it was from metastatic breast cancer that she didn't know she had for a very long time, because my grandfather, he also has cancer, and she's been taking care of him for so long. And so her symptoms just, she was admitted to the ER all of a sudden for pain in her stomach, and the doctors just told her it's cancer and it's gotten into different parts of your body and we need to start chemotherapy now and radiation right now. And my grandparents were just terrified, and they just got out of retirement, and so they just wanted to do as much as got into retirement. And so they took the first option and went with it. And my grandmother just got worse from there. And unfortunately, she passed away rather quickly after her diagnosis. And another thing I saw how that impacted other people around us is that my grandfather doesn't trust doctors anymore because she just got worse after radiation. And then eventually they just told her, we can't do anything else. And all we can recommend is hospice care. And so I think it's really important that not only when we have cancer diagnosis, we don't just talk to the doctor. I think we should be recommended to other people who have experienced things like this and speak with them and see what they suggest. And I think it's so great, Laszlo, that you shared your story. And I think everybody should have connections to cancer survivors and cancer communities.
Absolutely, absolutely. And I'm so sorry for your loss. And I know it's a journey. Cancer runs rampant in my family as well, which is a concern as I get older. And I have a son now, and certain cancers that run in my family are hereditary. And so, it's a reality and it's a concern. And that lack of trust is also an issue because of the outcomes we've seen in my family, in my community as it pertains to cancer treatment. So I want to kind of shift gears from the experience to kind of a wish list, because we do want this moderation to generate some connections, some collaborations, and outcomes. So if you can dial back and think back to your first initial encounters and experiences as you received the diagnoses or were approaching treatment, what are some things looking back that you wish you had during that time, during those difficult times? Maybe having, I know for me, with my aunt who passed from pancreatic cancer, we would always talk about her desire to have someone else that was going through or had beat it that she could talk to. She wished there was an app in the cloud, as she would say, in the cloud, as she would say, where she could just find someone to talk to and to share with and to go through it with, because we didn't understand her unique experience. So that was one of her wishes and desires. Can you all think back to anything that you wish was there that wasn't?
Just within the last probably 5-6 months, I've gotten more involved in a church men's group. And while doing that, I also realized that our area didn't really have a cancer support organization that's really convenient. There are some in the area, but it just wasn't very convenient, certainly for me. And so I approached one of the gentlemen that I know is very involved in our church community. And so we reached out and we started doing some research and ended up finding out through Gilda's organization in Chicago that there was a cancer support group out in our county and in our area of the Chicago metropolitan area. So to me, I think, back to your comments and back to her comments, somebody talking to someone in a cancer support group, because invariably almost probably all of those, if not them, but a caregiver in that organization or whatever, has experienced some of the things and may have said, hey, just like you said, are there doctors? Who did you all talk to? What kind of cancer did you have? And I've even gotten phone calls from a few of those folks already, just wanting to talk and chat and share information. So I think, some sort of like just a nice database of cancer support groups would be awesome for people to just be able to, at a click of a finger, go find.
Absolutely.
Me and my family, I couldn't agree with you more. It's one thing that you said earlier. I'm going back just a little bit, Laszlo. When be your own best advocate, it's a village of advocates, right? Because oftentimes a person who's experiencing the diagnosis may not have the wherewithal to handle everything, right? And so I think it's a village and understanding that. The second part to that, in the care group, I wish that I had, in my family and my kids in particular, had a support group for them as they were watching their father in his diagnosis. A very strong dad who was Superman, right? And watching and helping them understand. We got some help afterwards, but in the middle of the storm, it would have been nice to have had other families who were experiencing what we were experiencing and understanding and taking the kids just to play instead of being in the hospital, right? And so, and that we could trust them, that they, and why I could be with my husband and just hold his hand. And, so, and I know those sound like small things, but they're so important during your time of need.
Absolutely.
I also, I come from this from two different perspectives. One is I'm a 3-time cancer survivor. I was originally diagnosed 23 years ago when I was a young adult. And then my third cancer was breast cancer 2 years ago. So it's been interesting, the transition of seeing more support. And I agree with you, like on your being your own self-advocate, finding support. The other thing that I have found that I really, really wanted was from my physician, like from my oncologist. I wanted a care plan. I wanted to know my post-care plan. Like I'm a planner. Most of you who know me know that, like, I like to have a strategy. I like to know what's happening. Because for me, I felt, and I'm sure those of you who've been through this, like cancer made me feel like my life was out of control. And I wanted something that I could grasp onto to help me move forward. So I write a blog right now. I'm on social media. I share like as much about my cancer journey as I possibly can. I'm very open about it. I try to, like be very blunt about it, and also put it in terms that people will be able to understand and grasp. On the flip side, I also work in healthcare. So I manage all communication and education to thousands of doctors in Southeast Michigan. And my point with that is that I work a lot. When I started in this position and have grown it, the biggest thing that I am so proud of is that we develop patient education materials. So we'll develop posters and social media graphics and scripts for our practices to talk about why you should get your breast cancer screening, why you should get a colorectal cancer screening. And so in doing that, we're bringing, I found anyway, at least from a personal perspective, is bringing the doctors into the conversation and letting them know this is what your patients need. And I say that to my oncologist. When I finished my breast cancer treatment, I was kind of like, so what's the plan? Like, how long am I going to see you? How long am I going to do this? And she was like, oh, well, here's the survivor. I mean, I had to ask for it, which was fine, but I knew to ask for it. So that's a big thing I talk to a lot of survivors about. Like when your treatment ends, your journey changes. And so talk to your doctor about, just so you know, like you should keep up on this, you should do this, you should do that. So I think it's a great opportunity to also engage the medical community into, our conversations.
And I think that's amazing because listening to Tammy's story and the other wish items or wish lists that were presented here, creating resource materials is one of the first initial steps, even before we go to address the digital divide. Again, that health literacy piece is so important. So what can we do about that? Can we generate these materials, generate these contacts, generate a list of these available blogs and people you can meet with, generate a list of your church groups and how often you meet, and create these materials and just take them up there. I always see so many times at different facilities, libraries, even doctors' offices, people leave certain pamphlets and pieces of information just everywhere. So can we be a part of that? What can we do now? I like how Jody said, your everyday journey. What solutions can you generate every day? And it's not only to help those survivors and those affected around you as they're going through, but also to empower afterwards. After you've overcome or as you're going through, what can you do to instill hope, not only within those around you, but within yourself by taking action against cancer? As your body does the work, what else can you do to do the work to combat this? So I think that's amazing what you're doing. And please share all of the resources if you can with the group, because I do think that's an excellent start. And along with those health related resources, we can incorporate digital resources, like how you can access this information online, how-to guides, in addition with the health-related resources, will be really important in bridging that gap and closing that gap. So thank you for sharing, and please do share whatever blogs, resources, all of you, your help, your church men's group, share all of that information, because it's really going to start with compiling available resources. It really starts from a manual perspective before we even begin to scale the digital component. There's already internet-based support groups and things like that, but they're already seeing that the disparities, again, are just exacerbated because the commonality is that there's a health literacy gap. There's a confidence gap in how we communicate with our doctors and healthcare professionals. So how can we bridge that gap before we even bring in the digital component? We have to correct that first. So thank you so much for sharing. Any other wish list ideas or experiences you all have to share?
I think a wish list item for me, just based on the feedback I've gotten from our volunteers and other people I've spoken with, is there really needs to be a person that's the middleman between the really high level information and what you personally need. A lot of the times that burden falls to the caregiver, which can still be a lot for the caregiver. But it is nice to have a separate person who can take notes or something like that. But is there someone we could place in the room that could help simplify the information? Because I think, like you mentioned at the beginning, a lot of the times the doctors are pressed for time. They're going to say things in their own words to get it within that time frame, get the appointment accomplished. But that doesn't mean that the recipient of the information is understanding it. So there's a difference between sharing and understanding. And I think we need a person who can help bridge that gap. But traditionally it's been the caregiver, but we know that that really impacts the caregiver as well.
Right.
So is there a magic person like a PA or a nurse or something? I don't know if Callie has something to say about that, but that's my thought.
Or even, it really, I think that's a wonderful idea. And I would love to hear from survivors and the family of survivors of how comfortable they are with having a third party in the room. Because as we have approached in the past, as I've approached this conversation about health literacy and generating resources and databases, it's, what is that space like as you're in such a vulnerable moment to have a third party? Would you feel comfortable with a graduate level public health professional? Would you feel comfortable with a pre-med student or a med student that needs to complete, volunteer hours? Would that make you more comfortable? Would you feel more comfortable with somebody licensed or certified? What would be the comfort level? And then we can really dictate, reaching out to educational institutions or other certification boards and bodies about how to inject that, because all of these certifications require a certain level of hours, volunteer hours, and residential hours. Can we incorporate some of this liaisoning into that structure? But it really does start with, how comfortable would you be with that? Looking back, what would that be like for you?
Well, just to go, KK is a great idea. I love it because, so when I was originally diagnosed with bone cancer, I was 21, I was treated in pediatrics. And I have to tell you that it was amazing. Like it was, first time my family had ever dealt with cancer. My parents and I are sitting, the oncologist is telling me everything, and they had a nurse in there taking notes. So she took all of these notes, and then she had said when we were leaving, she walked us out, we talked a little bit more, and she said, I will get you all of these notes tomorrow and I'll go over all of them with you. So she called us, we got it, blah, blah, blah. So that's what happened at that practice, is anytime we had a decision-making meeting, she was always in there and basically translated everything to us. So when my dad was diagnosed a year later, he was treated in adults. And I have to tell you, we sat in that meeting, we were kind of like, where's our person who's going to take notes and translate this for us? So it was a very different experience. And then, so down the road. So I agree. And I personally would be very comfortable having I mean, the nurse was in there. I mean, if somebody is from their practice is in there, I have gone in with friends as the note taker too. You know, it's so you can bring a trusted person in too. But I agree with KK that it is nice to have somebody there just to listen to when you're so overwhelmed with everything going on. I don't ever go to doctor's appointments without having like my mom or my sisters in there just so they can hear something that I might not have heard.
Absolutely. That's a really great point, having a third party. And it's wonderful that, you know, the practice that you went to when you were so young had that resource. And I think that would be a great learning tool in med school, to have that component. It is very different in other communities. Having resources like that, or having access to healthcare where the quality of care is that where they would have someone available. So it's very different depending on the community in which you live. And so I think at the grassroots community-based level, it's really important to think about solutions that are specific to, you know, the demographic in which you fit. Because I know from our experiences, coming from more low-income areas, not having access to travel to certain facilities with better bedside care and doctors who weren't overworked and sometimes underpaid in those community health centers. The standard of care was extremely low. And so having the resources to have people available, you know, how can we do that at the community level? Since not all of these facilities have that, what can we do? Because we know that, you know, waiting for the powers that be or outside bodies to fix this problem, we'll be waiting for a long time. It's definitely going to take some boots on the ground to address this. So I think that's amazing, something that we could adopt even personally, like you said, having your mom or sister or someone able to come with you. And I think it's even more important to, like you all said, creating that database or compilation of resources, and making it available so that if someone, you know, finds a contact list, they can call and say, hey, I have an appointment. Are you able to come with me? Are you able to listen in? You know, if you're comfortable with that, creating those resources so that people who may be in different demographics or in different areas with different levels of resources can still access that type of care, can still have that liaison available to them. So I think that's a wonderful idea. And in practice, doing the work of creating a resource on our own for those facilities who don't have individuals like that available would be a wonderful start. Even before we reach into the digital component. Yeah, Ms. Hawkins said a village of advocates. Absolutely, absolutely. That's absolutely what's needed. So yeah, any other thoughts around this topic before we address maybe some of the issues you guys have had or seen or witnessed regarding digitized healthcare and how that's translated?
Not a different one, but I definitely agree with Heather's comment. It's certainly nice. Many times I would remember coming back from a visit or a consult or whatever the situation was, and my daughter would ask a question, and you know, wasn't able to give her some sort of specific information, and she understands some of that world because she's a sports dietitian, so she understands the physiology and some of the, you know, the stuff going on. And so I go, I don't remember exactly what it was called. And she says, well, why don't you guys take notes in there? Well, you know, you're so intent on listening that, so now I'm listening, and then you're trying to write, and then like this, again, not like our time should be our time. Whatever he needs to give us, he should give us, but you feel like you just don't want to be there for an hour and a half, you know, listening, regurgitating, writing down, making sure you understand every, you know, word, every sentence, you're hanging on everything they tell you. And so yeah, having that third party would be an awesome thing, I think.
You know, as you were talking, I thought, and I know this might be a legal challenge for liability insurance, but we all have these little devices, right? And so wouldn't it be nice if you could just hit the record button and gain permission and maybe play it later I don't know, I'm just thinking of like practical solutions right now. And then I have to tell you guys, we may get extended to 10 minutes. I've just been given a note. And if not, we will resume in the main room, but I just wanted to throw that out there too. But yeah, I'm thinking of because I know for me and our family, I used to carry a notebook for every appointment we went to. And I'm thankful for this conversation because I didn't recognize how privileged we were that I could take off work. And there were struggles, like my boss would threaten me on a number of occasions, right? But we still I was able to capture notes while my husband could focus on just listening to the doctor. But everybody doesn't have that, right? And so how do we get it for everyone?
And I think you mentioned a great point, using these devices. Even in my hometown and home community, the health department has begun to provide smartphones and cell phones and free service for communities who may be disadvantaged or disadvantaged populations within the community. So that's something we all do have access to. And I think it is very interesting to see legally what you could do, because it's on your own personal healthcare. Even if you record it for yourself, to go back and listen and, ask, hey, can I share this with you? Can you help me look this up online? I think that could be a starting point. And with that reference, even though an individual may not have been able to attend the appointment with you, they'll have a point of reference and maybe be able to assist you and bridge that digital gap if there's someone available that can say, okay, did you understand what this meant? No, let me show you how to find this information online. Starting there, I think that's amazing, because more and more we're seeing emergency broadband plans where they're providing discounted or free internet access for various populations, and again, like the free mobile and cell phone devices for certain groups. So I think that's something that could be applied to many different demographics across the board and build the network even larger. So I think that's a wonderful point, and something we should definitely look into. I see Heather said Livestrong has a guidebook, has lots of good questions to ask healthcare professionals. Absolutely. So let's definitely, I guess we'll get like an action document going where we can list all of these different links and resources and ideas to see if we can pilot or implement some of these in our communities, just to see how they work, or if they work. So I think that's great. That's amazing. Any other ideas or things you can remember about your experience that you feel like maybe having some digital training at that time, or some technical savviness would have helped you in your journey as you pursue treatment options, or exploring other oncologists in your region, or looking for support? Anything that you can think of looking back? Awesome.
Can I just add one thing from a patient perspective? I think that we also need to really let patients know. It's kind of when you're going back to saying that, and again, I work for doctors, so I'm going to say this though, but everyone thinks that whatever your doctor says is golden and you should listen to it and everything like that. So it does go back to being, your own advocate. But I think it's important to let patients know that you can ask questions of your treatment. You can ask for more information on that. You can, and it's also important for those of us who, like, I feel a little bit of a responsibility as somebody who's knowledgeable, good or bad in this field, that, I share, for instance, Livestrong has phenomenal materials like on fertility and all of that. So when I was diagnosed with breast cancer, I was asked by my doctor if I wanted to freeze my eggs and yada, yada. And then I said, well, by the way, here's this really good information that breaks it down into easy to understand information. And I have to tell you, my oncologist reaction to this was, she called me the next day and was like, oh my God, I read through this material. This is so easy to understand. It's so helpful. I'm going to share it with my patients. And so, again, working with doctors, like, they look for that information. They want that information. So if you have it, don't hesitate to share it. And also, again, as patients, let patients know it's okay to question what your doctor is asking you. It's okay to say, can we pause? Because I don't understand what you're saying to me.
Absolutely. Definitely. And I feel like a lot of times as a patient, we feel like, we don't have certain rights to advocate for ourselves, or to question authority. I think we're kind of trained like that as a society in and of itself, that there's some things you just don't question. And we really have to do the work of getting out of that mindset that even though we view a doctor as an authoritative figure, we have to understand that they're just people. They are just people that have a passion for their work, hopefully are great at taking tests and have made it through medical school, and so we have to try to bring it back and really know that, the only reason we have this healthcare system is because of patients. They're there for you, to serve you, to provide you a service. So the same way we go to a restaurant expecting a certain level, we have to bring that mindset into healthcare and really transform how we have conversations with professionals, and even within our families, starting these conversations, about how to advocate for yourself and the best way to do so. And again, there's many challenges. It's great to come up with these global solutions, but in different communities, it's so different. So I feel like it's so important where you live and the community in which you live, for you to institute things that work for your demographic. I can only think of a close friend of mine who English was not her first language. And so oftentimes there'll be a child in the appointment translating, within that appointment. Even though the doctor's office has resources where you can call and get a translator, that often takes an extended period of time, or people don't understand how that works. So there's certain differences or challenges that'll arise depending on the community in which you live or work or choose to work with moving forward. So these solutions are great to think of globally, but really what I hope you all take away is how to individualize it for your experience in your immediate community and people you come in contact with going through this journey. And it's in these individual communities and in silos initially, as it is, that we'll be able to see what works and then find a more globalized solution to the problem. But I don't think there's a one way to go about bridging this health literacy gap. There's no one way we can go about bridging this digital literacy gap because of all the other confounders and disparities that occur in healthcare. So we definitely initially have to share ideas, share resources, and then individualize these approaches for what works for us. And I think that's the major thing I hope we all take away, is how we can individualize this for our immediate community.
I just like to point out also that I do think it's incumbent upon the medical community to, as people are advocating for themselves, they have to figure out how to listen. Because I know, and in particular, I'm Black. So in the Black community, when you do raise questions to a healthcare professional, you're often shooed away and written off. And I'm sure other communities face that same challenge. And then, culturally, you're trying to figure out, or just personally, how to go back to it. And I think maybe, and I love how you say localize and make it personal and immediate. Maybe it's part of, in our communities, training people when you are shooed away, how to go back at it. Like, you may be the physician with all the letters behind your name, but I'm the patient. I'm the one, this is my body. So you need to stop and listen to me, or I will find a replacement for you. And it's really just that candid.
Absolutely. Know that there's patient relation teams. I always tell people, hey, if you're not satisfied, let them know that you're going to reach out to patient relations and that you want to speak to a practice manager or anybody, someone, because you don't feel your needs are being met. Make sure, say, hey, I've asked you this question, you didn't respond. Can you be sure that's notated in my medical record that you are refusing to respond? Usually they turn that around real quick. Can I get a copy of my medical record, of this appointment, showing that I've asked this question. And I think that point you mentioned earlier, recording these conversations will bring an added level of protection when it comes to this, asking for permission or saying, I don't even know if you have to ask for permission, honestly, to record your own individual appointment with a doctor, as that's your own, healthcare. Right. So that's an important point to make, because oftentimes gears shift and mindsets change when they know that someone's listening or there's a recording on. I'm going to, be on my best behavior and make sure I'm providing the best level of care. So I think that's excellent. I see we have 40 seconds remaining.
I'm going to check in and see, do we have the 10 minutes or not? So continue and I will.
Okay, perfect. So any ideas about kind of what we've been discussing up to this point and what we've shared? or how these challenges may translate as we move forward with the digital healthcare, because that is certainly looming. Completely digital healthcare. Are there any feelings about that? Just initially, digital healthcare, when you hear that, like, what does that make you feel like or think? I just think it's like impossible. Like, I don't know how you can care.
Makes it very impersonal.
Yeah.
You know, even with, you know, with the COVID and stuff that went on, a bunch of my sessions were a quick Zoom call or a telemed call. And while you certainly can, you know, relay the verbal information, right, as we all know, you know, we're very